Today we're going to talk about multiple sclerosis, also known as MS. It is a genetically linked autoimmune disease affecting the central nervous system. The disease commonly affects those between the ages of 20 to 50 years old and is more prevalent in women and inhabitants of the northern parts of the US, Canada, and Europe. Those diagnosed in late adulthood usually have a more progressive disease compared with those diagnosed at a younger age. Hispanics, Asians, and those of African descent are less commonly diagnosed with MS. The degenerative disease is chronic, progressive, and characterized by three pathological processes. These are chronic inflammation, demyelination, and gliosis, also known as scarring. It affects the CNS, the central nervous system. The disease develops when a genetically predisposed person is exposed to an environmental trigger, such as an infection or other factors such as smoking, physical injury, emotional stress, excessive fatigue, vitamin D deficiency, pregnancy, and poor health. Activated T cells from the person's immune system migrate to the CNS, breaks down the BBB, also known as the blood-brain barrier, and creates a reaction which activates the inflammatory response. Immune cells attack the myelin sheaths or fatty tissues surrounding the axons of the neurons in the brain and the spinal cord, leading to damage by demyelination. Nerve fibers are unharmed and impulses still occur, but they are slowed, which causes symptoms of weakness. When myelin regenerates, symptoms can disappear and a person can go into remission. However, as inflammation becomes continuous, nearby oligodendrocytes become affected and their myelin sheath loses the ability to regenerate, which leads to permanent damage of the axon and loss of nerve function. Scar tissue or sclerotic plaque eventually replaces the damaged tissue. With each episode of myelin destruction, multiple gliosis occurs throughout the CNS, which leads to progressive loss of nerve capabilities and paralysis.
Signs and symptoms of MS. The onset of the symptoms of MS usually begin around the age of 20 to 50 years old. It can be tricky to diagnose because symptoms can be vague and happen intermittently over months and even years. So patients might not see or question it until maybe after the disease has progressed further. Symptoms, severity, and duration and occurrence vary from patient to patient depending on what part of the central nervous system is affected. Symptoms usually reflect where there's communication issues or nerve damage. The list of symptoms can vary from person to person. There is a vast amount of symptoms you can have with MS. The symptoms depend on the part of the nervous system that is affected. So everyone with MS may experience different symptoms, and the symptoms may differ in the severity. Here are the common signs and symptoms and the less common signs. And then on the next slide, I have two images. One of the image shows how it affects a lot of the different body systems, and it gives the symptoms associated with each. And then the other image gives the percentage of how common each signs and symptoms are in the population with people with MS. Okay, so the iceberg phenomenon describes what a person with MS is going through. Above the water, you can see that tiny piece of the ice that's visible to others, which might be the mobility issues. And then below the surface that's hidden from view is all the issues that somebody with MS is suffering from or going through without anybody even being the wiser. So people looking in might misunderstand or underestimate what the person might be going through. So a person with MS would probably need to be vocal and let people know any signs or symptoms or any problems they're going through, because they may not be able to see just by looking at the person that they're suffering from all these different signs and symptoms. So a person with MS would need to let their healthcare provider know exactly what they're going through and be very vocal and very detailed about the signs and symptoms and what they're experiencing, because everybody with MS presents differently. Not everybody with MS will have the same signs and symptoms or severity or duration. So the doctor will need to know everything and all the signs and symptoms so he could properly prescribe treatment. Okay, this is a classification scheme. It basically describes the different categories: the relapse, remitting, primary progression, secondary progression, and progressive relapsing. It could be found in the medical surgical nursing textbook, page 1384, table 58-11.
Complications. Visual disturbances, as mentioned previously, such as blurred vision, color blindness, and diminished night vision. Dysphagia, sexual dysfunction, impotence for men, and vaginal dryness for women. Bowel problems such as fecal incontinence, constipation, or diarrhea. Bladder problems such as urinary retention, which can in turn lead to frequent UTIs. Nocturia, urgency and frequency. Bone fractures due to falls. Pneumonia due to weak breathing muscles that are unable to expand thorax and clear airway by coughing. Depression, fatigue, loss of cognitive function, loss of mobility, and muscle spasticity.
These are the diagnostic tests that can be done for MS. You want to do a history and physical assessment, CSF analysis, CT scan, MRI, evoke potential testing. There are diagnosis requirements. There needs to be evidence of at least 2 inflammatory demyelinating lesions in at least 2 different places within the central nervous system. Damage or an attack occurring at different points in time, so let's say approximately a month or more apart. All other diagnoses have to be ruled out. There is no single test alone that will diagnose MS. All tests are considered collectively with symptom history. Blood tests are also used to rule out other diseases with similar symptoms. So this is a picture of a CT scan versus an MRI scan. On the left side, we've got the CT, which uses less detail than the MRI, and it involves radiation. On the right is an MRI, which can show lesions or plaques, inflammation, and atrophy of the brain and spinal cord. On the right side, we can see that it's a lot more detailed, and you can see the approximations better. There are 2 kinds of MRI tests that can be done. The T1 MRI is used to show active inflammation and new lesions, but it can also show black hose, which can be indicative of permanent damage. The T2 MRI usually detects the old and new lesions, so it shows more of the disease progression. Another procedure that can be done is a lumbar puncture. The cerebral spinal fluid may show an increase in immunoglobulin G and the presence of oligoclonal banding. On the left is a picture of the location that a lumbar puncture is usually done in. The link below is of a video of the procedure. Nursing considerations post-procedure are telling the patient to lie flat for about an hour to prevent nausea and headaches. Providing adequate hydration is also important, and monitoring the puncture site for any bleeding or CSF leakage. On the right is an image of oligoclonal banding in the CSF. The S stands for serum or blood, and the C is the CSF fluid. Only oligoclonal banding in the CSF counts towards diagnosing MS. 90% of people who have MS have oligoclonal banding present in their spinal fluid. Evoke potential testing measures electrical activity in the brain from the stimulation from sight, sound, or touch. Sight would be visual evoke potential, sound, auditory evoke potential, and then touch, somatosensory evoke potential. Electrodes are placed in particular places corresponding to the test, depending on whether one is testing the visual, auditory, or sensory response. For example, Electrodes are attached to the earlobes as well as the scalp for the AEP. For the SSEP, the electrodes are placed on the wrist, back of the knee, and other places that have a neuromuscular response. An electrical stimulus will pass through the electrodes and then the sensory response will be measured. For MS, most of these responses are often delayed because of the demyelination of the nerves. The myelin sheath is not only protects the nerve cell, but it also is used in helping transmit nerve impulses.
Treatment for multiple sclerosis, you have the immunomodulator drugs, your interferons, your teriflunomide. The action mechanism of these medications, they are used for the treatment of multiple sclerosis by producing immune regulatory effects, which slows progression of physical disabilities associated with multiple sclerosis. Side effects, headache, flu-like symptoms, depression with suicidal thoughts. Nursing interventions, injection site reactions may occur, so I guess you want to monitor for those site reactions. Avoid administering in pregnant women. You want to advise your patients to wear sunscreen. Monitor your CBCs, liver function tests, since these medications can cause liver disease. Teach self-injection techniques to the patient, and treat flu-like symptoms with an NSAID or acetaminophen. Immunosuppressant medications, you have the mitoxantrone, dimethyl fumarate. The action mechanism of these medications, they are used for the treatment of multiple sclerosis by modifying immune response and slowing progression of multiple sclerosis. Side effects, you can have pain, redness, and itching at injection site. Nursing interventions, you want to report difficulty breathing, swallowing, any rash, itching, swelling of the lower extremities to the healthcare provider. Avoid administering in pregnant patients, and acquire CBCs, teach injection site techniques to the patient, and monitor for evidence of infection. Skeletal muscle relaxant. You have the baclofen, diazepam. The action mechanism of these medications, they are used for the treatment of MS by reducing muscle spasticity, which may be a sign of MS. Side effects, you can have drowsiness, dizziness, hypotension, and constipation. Nursing interventions, teach patients that symptoms of drowsiness usually diminish with continued therapy. Teach patients to avoid tasks requiring alertness, motor skills until response to drug is established. Assess for medication effectiveness and assist with ambulation. Teach patients to avoid use of alcohol while taking this medication. Sphingosine 1-phosphate receptor modulator drugs, like your fingolimod. The action mechanism of this medication can treat flare-ups of multiple sclerosis. Side effects, you could have headache, cough, macular edema, liver problems, swelling in the brain, decreased pulmonary function, and increased risk for infection. Nursing interventions, you want to monitor pulse and blood pressure regularly for bradycardia after administering the first dose. You want to monitor your patient for signs of infection. You want to monitor the pulmonary function test and perform an ophthalmologic exam prior to starting this medication, and then 3 to 4 months after treatment initiation for visual disturbances. Nervous system stimulants, your methylphenidate medications. The action mechanism of this medication is it diminishes the fatigue in patients with MS. Side effects, hyperactivity, insomnia, behavioral disturbances, dizziness, blurred vision, anorexia, constipation, dry mouth, metallic taste, nausea, vomiting, rashes, and weight loss with prolonged use. Nursing interventions, you want to monitor closely for behavior changes on your patient. This medication may lead to psychological dependence. You want to assess skin for skin changes and monitor for signs and symptoms of peripheral vasculopathy.
There are 3 main nursing diagnoses we will focus on for MS in the next few slides. The first one is ineffective health management related to knowledge deficit regarding management of MS. Since there's no cure in MS, its progressive nature can compromise patients' ability for self-care and cope effectively. The next one is impaired physical mobility related to muscle weakness or paralysis and muscle spasticity. As we mentioned in the signs and symptoms slides, tremors, poor coordination can interfere with the patient's ADLs and mobility. As a result, put the patient at risk for falls. Impaired urinary elimination related to sensory motor deficits. One of the issues that MS patients face is bladder issues such as urinary retention that places the patient to infections that can trigger an exacerbation of MS. Ineffective health management. MS is a chronic, slowly progressive nervous disease. Let's make sure we discuss the disease process in a simple, straightforward manner. Accurate information reduces anxiety and allows the patient to comprehend disease process. For example, we want the patient and the family to think about their long-term care. Instruct patient or significant other when to contact the healthcare team. This is regarding the exacerbations that patient may experience. We want them to report them immediately because an infection can quickly get complicated and be life-threatening to the patient. Also teach the patient about the drugs used for muscle spasticity. MS medication regimen is tailored to disease pattern and signs and symptoms experienced by the patient. Impaired physical mobility. We're going to assess the patient's gait, muscle strength, weakness, coordination, and balance. This is going to assess the progression and remission of MS. We're going to determine the patient's ability to use assistive devices. This will reduce the risk for falls. We're going to encourage self-care as tolerated and seeking assistance when necessary. Arrange home care when necessary and needed. This is going to be required during times of exacerbation, possibly. We're going to encourage stretching exercises, range of motions daily with scheduled rest periods. This is going to prevent contractures, maintain muscle strength, and rest periods will reduce fatigue. Impaired urinary elimination. We're going to inquire about signs and symptoms of urinary retention that can lead to an infection, therefore can trigger an exacerbation of MS. Bladder training, self-catheterization from a UTI can also trigger an exacerbation. Anticholinergics to decrease spasticity. That's mentioned in our text, page 387. Since bladder problems are an issue in MS, we're going to increase dietary fiber. That's going to help with the constipation. And we're also going to encourage the patient to drink 2 to 3 liters of fluid daily, which will then increase urinary output and reduce the risk for infection.
Patient teaching. Nutrition. Advise patient to increase intake of vitamin D, biotin, and omega-3 oils found in fatty fish such as salmon and mackerel. Teach patient stress reduction techniques. Also teach patient skin care. A person with MS is more likely to have pressure sores from lack of mobility, so advise patients to inspect skin daily for pressure spots or wounds. Vaccinations. Only inactivated immunizations are considered safe. Advise patients to avoid any type of vaccination between 4 to 6 weeks after a relapse episode. Exercise. Encourage patients to participate in some type of physical activity that they enjoy, such as walking, gardening, biking, and even yoga. Advise patients to incorporate stretching and strengthening exercises. The exercise routine should be performed according to the patient's physical ability. Stress the importance of keeping active regardless of exercise intensity. Water exercises such as Tai Chi, Haliwick, and any other type of aquatic exercise is beneficial to a person with MS because the buoyancy of water helps support weak limbs. Thereby, movements take less effort and a greater range of motion is achieved. There is greater overall relaxation. And as the person moves against the resistance of water, it aids to improve muscle strength. Water can help maintain a cooler body core temperature during exercise. And finally, a patient can create social networks that in turn improve mood and fatigue.